Now we're going to talk about more about urge incontinence because people get a sudden urge, I guess. Is that what it is?
That's correct.
How bad can it be if you've got urge incontinence and do you just pee a little bit or do you sometimes gush?
All of the above, and it can be very embarrassing. So you can have some that can just barely make it and might dribble before they get there. And then I've had patients that have been in Walmart and lost their whole bladder, and they will say, I do not leak, I gush.
And so when a patient says that, do you say, there are things that we can do, don't worry about it, let's get started?
That's right.
So what are some of the things that will stimulate the bladder to have the urge that you're going to have to urinate?
So caffeine is a notorious bladder irritant, and it
So
can
Cokes?
give you Cokes, tea, coffee,
All of those.
even
Chocolate?
Even chocolate, yes.
I always
chocolate.
tell people in allergy, I never make anybody allergic to chocolate.
Chocolate.
So all of those can cause urge incontinence.
Correct. Constipation is another common non-urologic issue because the same nerves that stimulate the bladder stimulate the bowel and vice versa. So if your body is sending a signal to move your bowel or constipation, your bladder will get that same input and you can get frequency and urgency and even urge incontinence.
Is that more difficult on the patient if you're having constipation versus guiding what you eat and staying away from caffeine, that sort of thing?
It is, but patients don't make that association a lot of times.
Yeah.
And so you have to sort of lead them down to realize that may be an issue and getting with their GI doctor or their primary care doctor to get that under better control.
So we control the GI tract, we control what we take in, we lose weight. How about those Kegel exercises?
They work for urge incontinence too. You can do bladder retraining with Kegels. So when you get that urge, the natural instinct is to jump up and run. But when you do that, you increase your abdominal pressure. So when you're getting a bladder spasm, you just encourage the leakage. So what we try to teach people, sit there, do your Kegels, and try to abort that urge. Then you get up and go.
So if you've got a patient that's having trouble, when you teach them what we've talked about, how successful is it? Can you really change the life of somebody by this?
You can, and again, for patients that are having trouble, we use our pelvic floor physical therapist for that as well. There are obviously people that don't respond to that. It's not 100% effective. So the good news is we've got other stuff for that as well.